Greetings and welcome to the Southside Help Center show. We'd like to thank everyone for tuning in. This is a live call-in show. If you have any questions about anything that we're talking about, please take the opportunity to call in and maybe we'll get those questions answered for you. The other thing that's wonderful about what's new here at CAN TV is that you can get this live. Let me go to the overhead really quickly. And this is what you need to do. For those individuals who are not in the city of Chicago, you can go to www.cantv.org and you can get a live stream. That is really an excellent option that we now have here at CAN TV. I truly appreciate it and thank them because there are a lot of people who may be outside of the Chicagoland area, and now they can get this information because it is so important that this information gets all over, not just here in the city of Chicago, but also out in the outlying suburbs as well. So thank you. And you can get www.cantv.org and you can get a live stream if you're not here in the city of Chicago. So when you get home, if you're on your way home, you can pick us up then. Again, thank you for tuning in. We'd like to thank everyone for tuning in because, again, without you, this show would not be possible. We thank you. This is the Southside Help Center show. A lot of wonderful things going on. One of the things we're going to be doing over the next few weeks or the next 12 weeks is we're going to be talking about the different programs that the Southside Help Center offers. Southside Help Center has been in business now for 25 years. This is our 25th year anniversary. And again, without you, that would have not been possible. So thank you for allowing us to serve you. Betty Smith, our founder, we'd like to really thank Betty Smith for having a vision back in 1987 to get this agency started to provide social services across the board. And we try to be a one-stop shop. And that's why we do the show, so that we can kind of highlight the programs that the center has to offer. So over the next 12 weeks, we'll be bringing you different segments, talking about different programs, how they can benefit you, how they can benefit your family, how they can benefit the community. It is very important that you understand that this is a one-stop shop, but it's all about the community. So thank you, Betty Smith, for having a vision and for allowing us to serve the community for the last 25 years. Also, thank you, Miss Vanessa Smith, who is our executive director, and she has kept that vision alive. And we thank you, Miss Vanessa Smith, for allowing us the opportunity not just to work here, but to serve here. So thank Vanessa and Betty Smith, our founder and our executive director, for allowing us the opportunity to serve the community. Today we're going to focus in on HIV prevention and education. Why? Because that has been our foundation and the basis for the center for a lot of years. And one of the things that I find that because so much money is being pulled from the HIV arena, and it's really scary. One of the reasons it's so scary is because people are still getting infected with HIV. And one of the things we talk about is, yes, we've been talking about HIV prevention and education over the last 25, almost 30 years. Here's the thing. It's like if you've been successful in prevention, so that means like, okay, we've been talking about HIV prevention over the last 25 years. So that means if we've been successful in providing people with good information and people are actually changing their behavior, then the numbers should actually go down because people are doing things differently. That doesn't mean that, yes, the older generation may have a lot of information about HIV, but we still got to be concerned with our new generation or our young generation, because if we don't continue to talk about this disease and shine the light on it, then guess what? It will get pushed to the back. It will get pushed down. The lights will go out. And guess what? The numbers will continue to rise amongst our young people. So it's so very important that we understand that HIV is still very prevalent in the African American community. And just because it's been around for so long, we've been doing prevention and education. Yes, a lot of people have taken that information to heart and they have made it much safer for themselves. But the one thing that we are so concerned with is the more money they take out of HIV prevention, the less opportunity we have to talk about this disease, the more our young people, again, when you start talking about what is our future, and if the young people are our future and we don't provide them with the same education that our elders have received throughout the years, well, guess what? This epidemic is going to get worse and worse and worse. And that's what we have to look at as a people, as a community, as a government. That yes, there's a lot of stuff going on with HIV prevention education, but the money is being taken out of the prevention, is being taken out of the outreach, it's being taken out of the communities. And yes, there are a lot of the older generations who have gotten good information over the years, and those numbers are maybe holding steady, maybe even come down some. But what about our young people who have not gotten the same information. Do we stop now providing HIV prevention education to our young people? And then what happens? Those numbers shoot up, and then what does our future look like? It looks very dim. So it's very important that we understand that HIV prevention is majorly important, and we have to continue to talk about testing. Why is it so important that we do testing? Again, we're going to talk about how this disease is spreading, because again, even still, you got people who ask questions like, how do you get this disease? How do you prevent this disease? If my sister get it, if my brother get it, if my mother get it, can I still eat off of the same utensils? Those questions are still being asked even to this day, and one of the reasons is because, yes, some of our elders, when I say elders, it ain't got to mean that you're old. It just means that you've been around a little bit longer, you've received some different information, and you know some different things. But a lot of the young people don't know, don't have that information. And yes, we still have to make sure we talk about repetition. We have to continue to say HIV prevention and education is important. We have to talk about behavior change, what needs to happen. How do we provide them with some necessary resources? How do we provide them with some alternatives to sex? Majorly important. If we stop now, I promise you, it is going to continue to consume us as a people. So it's important that the money keeps coming. And again, it ain't a lot of money, because I promise you, people who are HIV prevention, they do it because the passion is there. It's because the concern is there. I promise you it ain't because of the money, because there's not a lot of money in HIV prevention. And a lot of times when you're working in social services, you be lucky if you get paid. Why? We work on vouchering systems. That's a whole nother story, a whole nother ball of wax. So sometimes you be lucky to even get paid when you start talking about social service and prevention, because they are taking the money out. So the people who do this work have a passion for people, and that's what's needed in HIV prevention and education. The people still have the passion. So we thank those individuals who are still in the fight, who are still committed, who are still in the battle. I can name names, but I won't, because I could not. The list is so long of people who are in this, in the HIV prevention arena, because they care, and they care about people. How do you get this disease? Today we're talking about HIV prevention and education. This is the Southside Help Center show, and over the next few weeks we'll be talking about other programs and highlighting them. Today we want to make sure we cover our HIV prevention, because it is definitely the basis in which the Southside Help Center was started and it was built. How do you get it? Anal, oral, vaginal with an infected person. That has not changed. Anal, oral, vaginal with an infected person, or through needles. Not just intravenous drug needles, body piercing, tattooing. I always talk about when you go get those shaves, we talking about blood, because you have to look at those fluids in which is found in its highest content, meaning blood, semen, vaginal secretions, and that's how it's transmitted through those particular body fluids. So when you start talking about blood and blood is involved, there's a great risk there. So when we start talking about not just needles, intravenous drug needles, body piercing, tattooing, it is so important, people, that when you go and get tattoos, that they are using new and sterile equipment. Sometimes we just forget about that kind of stuff when we go and get those basement tattoos. And when I say basement tattoos, it's still going on. And whether they're using a needle and thread, or whether they actually have a tattooing instrument, they have to make sure that those needles are brand new, coming out of the pack. And if they're not concerned with your health, you must be concerned with your health. Again, this is a live call-in show. If you have any questions about anything that we're talking about, call us here at the radio station, not the radio, at the television station, and we can get those questions answered. This is a live call-in show. The number is 312-738-1060. It's at the bottom. If you are not in the city and you want to get us online, you can also go online and call us. That's at cantv.org, and it's live stream, so you can go and get us there and call. Again, we're talking about HIV prevention and education, and why is it so important. I still see on a regular basis young people, really, I'm saying young people because I be looking at them sometimes like, how did you get a tattoo? You 15, you 16. We know legally they can't be tattooed. We know that. But they're getting tattoos because there's individuals out here providing that particular service who are not concerned with the age restrictions. So if you're not concerned with the age restrictions, we know that you're probably not concerned with the health restrictions and concerns as well. So that's why it's important when we start talking about behavior, it's important that you take control and concern and be concerned with your own personal behavior, because everybody out here is not. And if you're providing tattoos for 15, 16, and 17-year-olds, and we know you're not getting parental consent, then the chances are you're not that concerned with making sure that you have new and clean instruments. So it's important that people who are receiving these services definitely it's important that you make sure that the proper things are being used. So we're talking about body piercing, tattooing, intravenous drug use, and when you go to the barber, if you have to pay $1 or $2 extra for a new razor, then do so. If you need to take your own razor with you, then do so. Do whatever's necessary to take control of your own health concerns. Again, we're talking about behaviors, not who you are, but what you do to put you at risk. Also, an infected mother to her unborn child before, during, and after birth. We talk about in breast milk because we talk about HIV being found in all of the body fluids, but it's not found in a high enough content as blood, semen, and vaginal secretions and those other body fluids. It will require you to take a great deal of those body fluids in, and a baby, of course, will be taking in a great deal of breast milk. So that's why we say an infected mother before, during, and after birth. How is it prevented? We know, and abstinence is key. Again, no sex, no drugs, no problem. That is a 100% way. No sex, no drugs, no problem is a 100% way that you don't have to worry about contracting HIV. Another 100% way is being in a monogamous and committed relationship, and the level of trust is there. That is a complete, and there's no HIV present. That is a completely 100% safe way. So it's important that we do create relationships and not sex ships. We create relationships with trust so that you can be in a monogamous relationship, know what that is, and again, that is another 100% way on which you can be safe. The other thing we talk about is prevention, and we talked about that at the top of the show. We've been doing prevention education for a lot of years, and yes, a lot of people have taken that to heart. So yes, we do think that people are being safe. We do think that the numbers have come down in certain areas for those individuals who, when we were at the height of the epidemic and all of the efforts were concentrated, people did begin to change their behaviors. But one of the reasons I'm talking about why prevention is still so important is because, yes, that group of people have gotten the correct information and maybe over the years change behavior, because we always talk about sometimes it takes time to change behaviors. So we have to take small steps in terms of behavior change. It's very important that you understand. When I say small steps in terms of behavior change, it's just like people who are smoking cigarettes and trying to stop smoking cigarettes. It's real easy to say just stop, go cold turkey, but we know for everybody out there who have tried to stop smoking cigarettes, cold turkey just doesn't work for everybody. So it takes time. So sometimes we have to take baby steps in terms of changing our behavior. So if I'm smoking 20 cigarettes a day, if I break it down to 19 cigarettes a day, that's a positive step in the right direction. So we're talking about behavior change. Sometimes it can happen like that overnight, but sometimes it requires to take small steps. So over the years, people who have been receiving prevention education through the Southside Health Center's efforts and other agencies, they have begun to change their behavior. So what about those who have yet to begin to change their behavior? We're talking about HIV prevention and education, which is one of the programs that the Southside Health Center has been offering for the last 25 years, and what you can do to keep that risk down. We're talking about the fact that there's not a lot of funding available for HIV prevention and education, so it's important that people change behavior. It's important that you get this information and pass this information on. I always tell a story about I ran into a guy and I was telling him about HIV prevention. He told me that it was my job to teach his kid. So I said to myself, well, what if I never meet your kid? How does that work? So it's important, parents, that we do take on the responsibility to get this information, not only get this information for ourselves, but also pass it on to our young people. Did a health fair over the weekend, and I'm going to talk about some of the health fairs that we got coming up and why these health fairs are so important. We're collaborating with the City of Chicago. The City of Chicago, I promise you, are doing phenomenal things. So we really would like to thank the City of Chicago, the HIV prevention staff. We also would like to thank the training unit, Mr. Dwight Hunter, and all of his staff, Marguerite Harrell, Memo, all of those individuals, Vicky, all of those individuals who have been providing training for us and other social service providers for all of these years. We thank you because you have made us extremely professional. So thank you, Mr. Hunter and the Chicago Department of Health training unit, because they have provided us with a lot of great information, and as things come, they provide us with update training. So we thank you, Chicago Department of Public Health. Also, we're collaborating with them on this weekend. We got the Taste of VON coming in. coming up this Saturday. It's going to be held on 87th Street, right across from the radio station. The reason I'm saying is because, yes, it's the Taste of VOM, WVOM, but we're going to be providing free HIV testing. It is so important that people know their status. Why? When people know their status, they tend to change their behavior. When you look at a positive test result, that does not mean I'm going to die. That means that you need to change behavior. You need to look at doing some things differently. Positive test results mean that you need to get into treatment and care. There's a program called BTAN, which is a Connect to Care program. Mr. Louis Spraggan. If you are HIV positive and you are not receiving care, please give Louis Spraggan a call. His number is 773-445-5445. It'll get you a direct line to Mr. Louis Spraggan. If you are HIV positive and you are not in care, Louis is one of those individuals who I talk about that is very compassionate about his work. He will make sure that you get everything that you possibly need, or everything that he could possibly refer you to, you will get it. It's a Connect to Care program. It's called BTAN. I'm going to have Louis in the upcoming weeks to give you a little bit more information about that. So if you're an HIV positive individual and you need to get connected to care, this is one of the things that need to happen. We're talking about people who test positive and what needs to happen. It's important that you get into care and treatment and care. Why? Because the one thing that I find that people who are HIV positive, people think that they know everything it is to know about the disease, and that's just not true. So it's important that when people test positive, they do find out as much about the disease as possible, but they also need to get connected to care. Why? Because you'll get the medication if necessary. You'll create a relationship with a doctor. You'll also find support groups for not just you, but for family. I always say that we are all affected, if not infected. That just means that when one of your family members become impacted with HIV, it affects us all. And we've been talking about that like 10 years ago, we said that everyone would know someone who was impacted by HIV. That has come to pass. So everyone knows someone probably who is impacted with HIV. So when we say it's not just the individual, but it's also the family and all of those who make up that individual family, that's what we're talking about. So we know that they need support groups as well. We know that we need to continue to talk about HIV prevention education and how this disease is transmitted. It's so important. And that's why we say get tested. Know your status, because when you know your status, be it positive or negative, you can get directly into care. If you come up negative, that is big, but you need to look at the behaviors that you're practicing. One that's either putting you at risk and you just been lucky, or the things you're doing positive, not only that you can continue to do, but share. And that's what it's all about. If you have any questions, this is a live call-in show. Don't make us waste our money with a phone tech. Call and ask questions if you should happen to have any questions about what we're talking about. Today we're talking about HIV prevention and education and what we can do to stop the spread of HIV. We're also talking about testing. Why is it so important, and how you can acquire or receive testing. Let me say this. The Southside Health Center provides free HIV testing. You can call the center or come by the center if you haven't been tested, and you can get a free HIV test. The other thing we do is we work and collaborate with agencies across the board. And let me say this, Walgreens is bad. Walgreens, and I say bad in the sense of good, they have been phenomenal in supporting the Southside Health Center's effort to definitely stop the spread of HIV. So thank you, Walgreens. Mr. Freeline over on 75th Street, they are phenomenal assisting us. Dr. Tanya Campbell, let me say that. Yeah, I'm name dropping because these people are in the community and they're providing services in the community in terms of collaboration, where we can definitely educate as many people as we can about this disease and get as many people possible as tested. And that's one of the things they've been pushing, testing. And ironically, it's like now, when they start talking about funding, they only want to fund those agencies who can come up with what they call a 1% positivity rate. Ironically, it's crazy, and I'm not going to get too technical or too deep into that. And that just simply means for every 100 persons you test, they're looking for at least one of those individuals to be positive. And that's who they're funding now. So it's important that when they start talking about testing, and one of the reasons it's so important that a positivity rate is put into place because, one, we want to make sure that we're targeting the right individuals and making sure, one, that people know and get into treatment and care. Because when people know and get into treatment and care, they stop or change their behavior and less likely to pass the disease on. So there's a reason behind everything. So let's not get into the technical part of it, but it's very important that we continue to do testing, that we continue to identify people, because we know years ago, people was testing for HIV, and by the time they found out they were positive, the disease had progressed to the point where it was almost too late. That it was not a whole lot that can be done. And as the years pass, things change. Early detection is like key. The earlier an individual know if they're HIV positive, the better treatment and care they can get into, the relationship they create with the doctor. So we're talking about how this disease is transmitted, how this disease is prevented. We also want to talk about condoms. Condoms is a very, very vital part of HIV prevention. One, because a condom used correctly is 99% effective. So condoms have been, we've been talking about condom usage for years, not just to prevent pregnancy, but also to prevent HIV and other STDs. And as the weeks come, we're going to talk about STIs. STIs is sexually transmitted infections. And why we're going to talk about that? Because people are more susceptible to HIV and other things when they have other STIs or sexually transmitted diseases. For the old folks, VD, the claps, and all of that other stuff. That's what we used to call it. As time went on, we have changed the name. Now we're at sexually transmitted infections. So it's important that we know what those are, what they look like. I'm going to talk a little bit about those in a second. But again, we were talking about prevention. One of the things that the Southside Health Center is doing is they're a condom distribution hub for the city of Chicago. So that means if you have an organization and you are getting high traffic and people looking for condoms, you can become what we call a condom distribution or a condom distributor. Give me a call at the agency, 773-445-5445. We'll get you registered, and you'll be able to provide condoms for those individuals in your community who are coming on a consistent and regular basis. And you'll find that we have condoms in so many non-traditional places. And the surprising thing is, oftentimes when I go to the gas station, I'm always in there. Somebody's in there looking to purchase or buy condoms. So let's say, yes, some people are using condoms. One of the things we want to do along with the city of Chicago is we want to make sure the condoms are available at all costs. So we're going to give them to you for free. And again, we got all shapes and sizes of condoms, so it's important that people know proper size, proper condom, whether it's latex, whether it's polyurethane. We got the female condom. Female condoms are big time. They are big, and now we have a female condom campaign where we have some different things going on with female condoms, and this allows women to empower themselves. Normally it's like, do you got a condom? And if you don't got a condom, then there's no condom present. And so most of the times when the question is asked, you at this level. It's not most of the time. Sometimes now we're going in and immediately want to know, do you have a condom? You have a condom? So we got to check to see and make sure that happens before you get here, because a lot of times once people get here, if there's not a condom present, the chances of them stopping to go acquire one is most of the time non-existent. And that's one of the reasons that we want to make sure that we can get as many condoms into as many people's hands as possible, so we provide free condoms. You can come by the Southside Health Center anytime. We're at 10420 South Halsted. You can come by there anytime and get as many free condoms as you need. 10420 South Halsted. We're right next to Messiah's Temple on the other side of Larry's Barber College. You can come in there and get free condoms anytime. So again, Southside Health Center is a condom distribution hub for the city of Chicago. If you're an agency who wants to provide condoms in your community, give us a call, 773-445-5445. Extension 17. We'll get you set up so that you can provide free condoms. Today we're talking about HIV prevention and what we can do. This is a live call-in show. If you have any questions about anything, please do give us a call, 312-738-1060. The number's at the bottom. If you're not in the city and you would like to view the CAN TV show, you can go online now. Very important that people know. Now you can go to CAN TV Live, cantv.org. Let me make sure I'm getting it right. It's cantv.org and live, and you'll be able to get a live stream to CAN TV. So please, if you're not in the city, you would like to be a part of the show, you can go online, check us out, give us a call if you have any questions. This is a live call-in show. Give us a call if you have any questions. We got multiple events going on over the weekend, so it's very important that if you have not been tested and you would like to get tested, come on out. We got the Taste of VON, WVON this weekend. We're going to be on 87, right across from the radio station. If you want to get tested, we're going to collaborate with we're going to be in collaboration with the City of Chicago. So come on out. If you see the City of Chicago booth, if you see the Southside Health Center name, if you would like to get tested, come on over. We're doing an oral quick test. The oral quick test takes about 20 minutes, so you can actually get your results that day. And it's very important that people get those results. So come on out, get tested, get you something to eat, whatever you want to do. Again, why is it so important that people know their status? Because early detection is key. The more you know about this disease, the earlier you find out about it, the better your chances are. So come on out, get tested, tested. Next week, we'll bring Mr. Marcus Flanau on. He's going to be talking about some of the youth programs that the Southside Health Center has to offer. The Southside Health Center 25th anniversary. We'd like to thank everyone for tuning in. And again, until we see you again, we bid you peace.